we're asked to discuss two closely related um, topics in pediatrics. All right. So the first one is what is known as the determinant of. They said that write short notes on the following: determinant of child health. Then also you should write short notes on APGAR score. Okay, you should write on determinant of child health. Also write on what? APGAR score. All right. So what we have here is this. We'll start with determinant of child health. Okay. So of course, APGAR score is you are trying to access those determinants. Do you understand? So that's why I said they're actually closely related topics. So these determinants, just like it literally means, determinants of child health are actually factors that influence how the child will physically be, how they will mentally be, how they will socially be. So they operate before birth, during childhood, and throughout the time of what development of that child. So we have biological factors like the genetic makeup of the baby. Did the baby inherit some one or two disease conditions from the patient? Our birth weight. Was the child giving birth with a low birth weight? Okay, because if a child is giving birth with a low birth weight, there's a whole lot of complications, including a higher risk of dying. Their nutritional status, immunization status. We have the maternal factors, like what was the health of your mom when she was pregnant with you? What was the antenatal care you guys received? What was the nutrition your mother was on? Was it adequate nutrition? Was your mother having infections like HIV or malaria? Was your mother using alcohol or smoking? That's substance use. Then environmental factors, that's like basically the environment where you grew up. Of course, it has a lot of effects on you. So quality of housing, what is the access to clean water and sanitation, exposure to pollutions or toxins, the areas you guys were playing at, were they safe? Okay, was there overcrowding? Those are all the things you look out, okay, on the well-being of a child. Then socioeconomic factors, you are looking at the family income and parental education. Are the parents illiterate or educated? You are looking at the employment status of the parents. And you are also looking at the environment, okay. How easy is it to actually access healthcare services in that particular environment where the child was born? The cultural and behavioral factors, you are looking at the feeding practices. Some cultures, the child, even below 6 months, they start feeding him with whatever, okay. So they usually what advice for exclusive breastfeeding. All right. So you are looking at the hygiene practices, looking at the health seeking behaviors, their cultural beliefs, okay, that those particular set of people have towards illnesses. Then health system factors, you are looking at even if there's a health facility, do they have skilled health workers? Do they have access to immunization? Is there availability of essential medicines? Do they have a functioning referral systems? So these are all the things that you are trying to actually put into considerations when you are looking at the health determinant factors of a child. Then for the APGAR score, it's just a quick assessment of the health of the child. Okay, so once you give birth to the child, that's immediately within 1 to 5 minutes that you give birth to the child, you are supposed to actually access the APGAR score. So letter A, just like we have the APGAR, is a mnemonic, right? A stands for parents, P stands for pulse, G stands for Grimace, okay? Then A stands for activity, R stands for respiration, right? So the appearance, you're actually looking at the skin color of the child, and you are scoring the child between 0, 1, or 2. Okay, so of course you are not, it's an exam situation, you are not going on to now describe APGAR score in depth. Do you understand? You're just trying to list the parameters and do your way. So the P is the pulse, alright, that's a heart rate, so you're trying to access it. G is the Grimace, so you're trying to look at the reflex. A is the activity. You are trying to look at the muscle tone. All right. R is for respiration. You are trying to look at how the baby is breathing so easily. Okay. Do you have to aid them to breathe, or they're actually breathing spontaneously? So by the time you score the baby 0, 1, 2 on all these 5 criteria, if you add everything now, if you get between 7 to 10, your baby is normal. If you get between 4 to 6, your baby is moderately distressed. Okay, so the baby might need some stimulations or oxygens. Then if you get between 0 to 3, that's to say that the baby is severely distressed and the baby will need some immediate resuscitations. So purpose of the APGAR score is to assess the newborn's health, or you call that vitality, to guide if the resuscitation will be needed, okay, and also to monitor the interventions to also know the type of interventions that